Before we get started today, a friendly heads up that today's video discusses binge eating disorder, which some viewers may find sensitive or emotional. Please feel free to skip this video or take breaks as needed. Your well-being is important. Today we have a guest, Dr. Jennifer Dorau, who will be helping to undercomplicate the topic of binge eating disorder. Welcome to Undercomplicating Stuff, where we, two psychologists and coaches with over 40 years of combined experience, share our insights to help undercomplicate important topics. A friendly reminder that this video is meant for conversational and entertainment purposes only. Please see the information section of this video for additional resources. My name is Dr. Julie Radico. I am a psychologist, a coach, an author, and a speaker, and I'm here with Dr. Stacey Gedian.
I'm Stacey Gedian. I'm a health psychologist and the founder and CEO of a healthcare consulting and professional coaching business. And we're really excited to have Dr. Dorau here. Before we launch into questions, which we have a lot, can you please introduce yourself?
Thank you for having me. I'm Dr. Jennifer Dorau. I am a licensed clinical psychologist and an assistant professor of pediatrics at Penn State Health Hershey Medical Center. Been working at Penn State Health for 13 years now in the Division of Adolescent Medicine and Eating Disorders, working with kids and teens and families. And I specifically am the specialist in the treatment of binge eating disorder.
Well, we definitely have the right person in the room. And could you start off by simply describing what is meant by binge eating disorder?
Binge eating disorder actually only became a recognized eating disorder in the latest edition of our diagnostic and statistical manual. So it's relatively new, but it's been around for a long time, just not defined as an eating disorder. So binge eating disorder is not simply overeating, emotional eating, eating a little bit too much at a meal, or eating unhealthy foods, right? So it is eating large quantities of food in a relatively short period of time that is more food than people your age would eat given the same circumstances. And there's this feeling of I'm out of control. So I could not stop even if I wanted to. So people talk about feeling trance-like or on autopilot, and it is using food in response to a negative or overwhelming emotion. It is often used not when hungry. I'm feeling something big, I don't know how to handle it, and I'm using food to soothe. There's a lot of secrecy and hiding and sneaking in this disorder, and it is actually the most common eating disorder diagnosed in the United States now. There are more men and women, boys and girls, with binge eating disorder than there are the other more traditional eating disorders of anorexia and bulimia. But there's a lot of shame around this disorder. It's seen as not the good eating disorder to have. It's the one of overindulgence instead of self-control, or saying no, or weight loss. There's often weight gain. A lot of times these folks live in larger bodies. So there's a lot of shame. And that's one of the biggest misconceptions of this disorder, that it's just a lack of willpower and dieting, that it's not a real eating disorder, right? But a lot of times there's that same internalized, drive to be thin, drive to like your body, to desire your body. It's just not achieved through weight loss.
You bring up so many important pieces to understanding what's going on just by that definition alone, and the fact that there's a lot of emotions that come along with binge eating disorder, like shame, and that it's judgment and so many levels around people who are dealing with this. And so it makes me think about how compassionate we need to be towards people who are facing this challenge. And I wonder if you could share, how might somebody know that they're dealing with a disorder? Like if somebody, we all live in America, we overeat at times. You might go to a family event, especially around a holiday, and you are like, yep, I ate way too much and I'm full, but I'm just going to keep snacking here. Or like, how would somebody have a sense of like, this is a time where I should be concerned?
The difference between sort of emotional eating, or even, overeating at Thanksgiving or a party or on vacation, and binge eating disorder is that those other times are much more what I would call episodic or short-lived. My boyfriend broke up with me. I ate a whole gallon of ice cream. I felt better. But now that I'm not sad anymore, I don't continue to eat like that. So binge eating is fundamentally different. So it's more entrenched in a person's life. It becomes their sort of go-to coping mechanism, even when triggers vary. It might be sadness for this binge. It might be anger for that binge. It might be anxiety for that binge. But the binging is the go-to coping skill. Whereas for other times, those overeating periods are triggered by a very specific thing and not by everything. The eating episodes are more severe and they're more frequent. So I'm not binging once a year. I'm binging several times a week. In fact, that's in the criteria. You have to be binging more than one time a week for at least 3 months to be considered for this disorder. So if you don't meet that criteria, it just hasn't risen to that level. It's more dissociative and impulse driven. That's that loss of control. Like, I'm not making a conscious decision to go and do this. I feel like I can't stop myself. And it's harder to change. Even with therapeutic interventions, I just keep returning to this behavior. And there's more what we would call sort of the underlying drivers in binging. So the anxiety, the depression, the trauma, the loss, profound struggles with body image. So if it's all those sort of negative feelings, I'm using it more frequently, I'm using it to greater volumes of food, and it does not seem to go away. Once the sort of bad thing has gone away, then it's rising to the level of the disorder.
Thank you for adding more information in terms of what differentiates maybe an overeating episode, or again, we'll hear people just saying, oh, I binged last night, and they ate, as you mentioned, a gallon of ice cream or a bag of potato chips, and absolutely that is not a binge eating disorder. To your point that if that were to continue and be persistent and have the shame and the being driven to do this, then it might be time to seek some assistance or an evaluation. I'm wondering about the impact of social media on body image, binge eating disorder, other disorders. Can you speak a little bit to that?
Individuals with binge eating disorder, both online and offline, are often up to 10 times more likely to be victims of weight stigmatization, cyberbullying, weight-related teasing and bullying, either in their past or currently experiencing it, weight-related bullying in their own families and homes, even weight stigmatization by medical professionals, and weight loss constantly being prescribed as sort of the cure to this issue in a way that it's not with other eating disorders. So what we see is a lot of shame and embarrassment and hiding of this disorder. So people get very brave behind screens. So you get a lot of the weight-related bullying behaviors online. And then with influencers, especially in the nutrition world, fashion world, everybody is curating sort of this image that we see in snapshots on the screen that people start to think is the only way. You don't see representation necessarily of all bodies on social media. And then you also see high ad-driven content, especially for the newer GLP-1 weight loss drugs. And a lot of people with binge eating disorder come in seeking that specific medication and believing that that is the answer to the problem, which is just, if I lost weight, I wouldn't have to do this anymore.
It's so hard to not take in messages about what you're supposed to look like or the weight you're supposed to be. And what I'm hearing you say really thoughtfully is that even messages that are coming from well-intentioned places, maybe like your primary care clinician, can really be processed inside of us in an unhelpful way that can turn into really like damaging behaviors and make it really hard to soothe ourselves in a way that isn't somehow harmful, like binge eating.
Weight-related bullying or discrimination is really our last acceptable form of bias and discrimination, especially on social media platforms, which are also relatively new. I had recently done a presentation on social media's impact on adolescents, and MySpace only started in 2003. Facebook 2006, Instagram 2010. I mean, these are new platforms. You had to make a lot more effort to bully someone prior to 2003, about their body shape and size. And it is acceptable for us or allowable for people to still comment on someone's body shape and size and use that to determine a person's worth and value. And that is so damaging. And now teens are living chronically online, so we don't get a break.
I remember the days where when you went home, you had some solace that you weren't just chronically connected to everybody all the time. You're getting all these messages from media all the time to you have to look a certain way. And I remember growing up with magazines where think of a pop star or a musician or somebody whose body changed in the slightest way, and it was just highly monitored and then speculated on and talked about. And just the fact that we should be able to live in our bodies without any comment about it, whether good or bad. Your body is just your body. It's just trying to help you do what you need to do and doesn't need to be a vessel for judgment, but there's so much layered on. And I'm so mindful that you do really important work. And I'm curious if you could share with us, what are some of the treatments that you use to help people who might be dealing with binge eating disorder?
Binge eating disorder treatment is rarely about food, diet, or behavior modification as far as eating behaviors. These folks are not unintelligent. They don't not realize that eating 2 cheese pizzas in an hour is unhealthy for them. It's actually condescending to a lot of our folks to be like, well, you should just try an apple instead. They know that. They're very intelligent. We do see a lot of folks with binge eating disorder live in larger bodies just because they are consuming such an excess of calories. However, weight is not a determining factor to get diagnosed with binge eating disorder. There is no criteria in our DSM-5 that says they have to be at a certain BMI or a certain weight to have binge eating disorder. So not all individuals who are obese have binge eating disorder, and not all individuals with binge eating disorder are overweight or obese. A lot of that's down to genetics and how our bodies, can process, or the frequency in which we engage in the binge eating behavior. That's important to remember when we're doing treatment. Unlike anorexia and bulimia nervosa, where nutrition therapy is very important in the modality, it is not helpful in binge eating disorder. They have often been put on many diets, putting themselves on many diets. So giving that person a meal plan to just fail at is not very helpful, and it just increases shame and it increases dropout. What we have found to be highly effective is a combination medication, helping to control the impulse-driven nature of it, and then to also cut down on some of the food noise in the brain that drives a person to look for food. No GLP-1s are prescribed for binge eating disorder. That has not been proven to be helpful, or it just cuts down on appetite. And it's not an appetite problem, it's an emotion regulation problem. I have never met a patient who just has binge eating disorder organically. That's the only diagnosis on their chart. Binge eating is really a coping mechanism to deal with intolerable feelings and lack of coping strategies at their hands. And we binge on lots of things. We binge watch TV. We can binge on drugs and alcohol. We can binge on gambling. We can binge on books, shopping. It's just for binge eating disorder, the binge substance is the food. But what are the goals? So the primary goal is to decrease the frequency of binging and eventually cease binge eating. But there's no target weight loss, no, just weight stabilization, really. Behavioral sort of weight loss programs demonstrate little efficacy. They don't work. They work in the short term, just like any other diet. What we really want is self-regulation of affect, distress tolerance skills, interpersonal skills, trauma healing, self-esteem building. Dialectical behavioral treatment works very well for these folks. And what we're really finding too is the newest research is looking more at specifically binge eating as more of a substance use disorder than it is as an eating disorder. It shares a lot of the same brain mechanisms, same brain pathway, same rewards. Centers get lit up by the binge eating. So it's just not alcohol, it's food. So we look at a lot of sort of the treatment modalities in the substance use world are really effective for binge eating, which is distress tolerance, affect regulation, interpersonal skills, and trauma healing.
That's incredibly helpful that you've really differentiated of the types of eating disorders that we currently treat, that this is really something a little bit different and may fit better under a substance use disorder model. And thinking about people getting the proper care, do you have suggestions for someone to advocate for themselves so that whether it be with their family members to be able to get in to see a provider, or perhaps they're an adult and maybe the medical provider isn't as familiar with the disorder and sort of goes to the, will just eat less, count your calories, exercise more. How might someone advocate for themselves?
Right. So we know that shame and sort of bullying behavior makes it worse, not better. Folks, especially in larger bodies, find it very hard to advocate for themselves. So it seems that the answer to every ailment is just lose 10 pounds or just eat a little bit less, and this thing that's happening will go away or you'll feel better. It is okay if your primary care doctor says, I think you should go see a weight management specialist, to say no. It's not a weight management issue. Now, if it's a real weight management issue and not binge eating disorder, sure, treat that medically. But the referrals from a doctor should be to a therapist and a psychiatrist, not to another medical professional, unless they are in larger bodies and there are some consequences of poor nutrition. So if there is high blood pressure, yes, should you treat that at the cardiologist? Absolutely. But the binge eating disorder, the binging, will not go away until we heal the thing that's driving it. And that's the depression. That's believing that we can't tolerate discomfort or we can't tolerate pain. And that can't be healed in a PCP's office, right? When my patients come to see me, they're never weighed. I don't care about your weight. That's not important to me. I don't want to see your food journal. I don't want to see a meal plan. I'm not going to celebrate if you've lost 10 pounds. That's not important. But were you able to deal with disappointment without going to McDonald's? Then that's a win.
This information is so helpful. What would you say if I had a loved one that I thought might be dealing with this? What would you encourage I say to them?
One of the things, especially in adolescence, but this could even be in a married couple, and there's a lot of hiding and sneaking. This is done in private. It is not like, hey mom, I'm binging, so a lot of times we see the evidence of the binge, not the actual binge. So you might be going in your child's closet and you find that's where that box of Pop-Tarts went. You find wrappers, or you find insects or rodents, and that's because they're finding, the food remnants. Or you might look at your spouse's credit card bill and you notice that there's a lot of grocery store runs, and you've never seen that food in your house. So often I would tell a parent, if you come to your child with wrappers that you found in their room, the first question should be, what were you feeling? What were you feeling? Because binging is to stuff down, literally stuff down and avoid feeling, to numb it out, to numb out the pain. So what were you feeling? Were you anxious? Were you scared? Were you sad? Were you angry? Were you bored? Were you tired? Because that's what that evidence is. That's evidence of intolerable feeling. I have quotes from some patients of things that parents have or loved ones have said to them that are not helpful at all. These are things we should not say. These are their helpful words of wisdom. If you always binge on carbs, don't eat carbs. Not helpful. Have you tried Overeaters Anonymous or Weight Watchers? Consider a lap band or bariatric surgery. You'll lose weight and feel better about yourself. Exercise more. Measure out all your food according to the list I'm giving you and don't go over that. Try the keto diet. You're too lazy. You should just move more. This is your fault. Don't you care? Why can't you just stop? None of that. That just creates more shame, more hiding, more guilt, more sneaking. How can I help? What are you feeling? Those are the best questions to say to a loved one.
That was so enlightening and helpful to have you read the comments that some people, probably a lot of people, struggling with this have experienced. And as you were reading those off, I just felt heavy and felt like, wow, that would be very depressing and then anxiety provoking and all of these things. And I'm wondering if you could speak a little bit about how maybe binging behavior might be part of other disorders and maybe how to tease some of that out.
The use of food or binge eating can be seen in a lot of other mental health disorders, but it does not hit all of the criteria that is required to diagnose the binge eating disorder. So we want to make sure that we're really teasing it out. Two common examples are neurodivergent people, people with autism on the autism spectrum, and people with ADHD. The sensory stimulation that you get from overeating on food, the pleasurable dopamine hits that you get from food, the impulsivity of ADHD and autism can lead to binge eating. Especially also in ADHD, you get rebound hunger off of the stimulant medication. So kids who are not hungry all day will binge eat at night, but that's simply because their hunger was masked. Those kids don't feel the shame, guilt, and embarrassment about their binges that you would find in binge eating disorder. They don't really ever desire it to stop. It's just what I do. So autism, you can see that. Bipolar disorder can have binge eating components to it. And it's also related to binge eating disorder genetically. So a lot of times you can see overlap in behaviors. Trauma responses, oppositional defiant disorder, sensory processing disorders, depression, just being taught as a child that food was used as a reward or that it's self-soothing. Sedentary lifestyles and boredom can lead to binge eating. And then just sort of reactions to chronic stressors. That's that emotional eating part, but it does not rise to the criteria of binge eating disorder. So it takes a skilled clinician at times to tease this out. Is it because of this, or is it its own distinct disorder? So it's important sometimes to make sure you're seeing a specialist if you're concerned that you might be struggling with this.
There's so much nuance here, and it really just reinforces the idea that you need to talk to a professional, somebody who can help you figure out what your truth is, and that it's not as easy as just labeling, oh, this is this, and I've encapsulated all the nuances of how I'm experiencing this. I think that's such an important point. So my key takeaway from today and thinking about all the great information that you shared is really those questions that you encouraged you ask. And I am reflecting on the fact that those might be questions to even ask yourself or to ask a loved one. Like, what were you feeling? So if I'm experiencing anything in my life, it's a really great moment to check in and ask myself, like, how am I feeling? Or if I did something that I'm like, I don't really understand why I was doing that. Like asking myself, like, what was I feeling? And then asking that to your loved one in a very open, non-judgmental way. Like, what were you feeling at that time? And then that really great pairing question of like, how can I help? Or what support could I provide? Or for yourself, like what support might I need right now? Like what was I feeling and what do I need right now? What would help me right now? I think that those are really important and great questions to take away.
My key takeaway, which I think will provide a lot of maybe relief and hope for people who have been struggling and haven't quite found the right treatment, is Dr. Dorau, when he said that treatment for binge eating disorder is rarely about food, diet, or behavior modifications related to food. I think that provides such hope for people who have been through what you mentioned earlier, where it's eat less, exercise more, just don't eat this category of food. And I really think that that provides hope for people. And key takeaway from you today.
Right. I would like for us to take out the eating part of it. And it really is a binging disorder. And it happens to be using food as the thing to binge on. But it's the use of a substance or a behavior to regulate my emotions and deal with intolerable feelings or pain that I don't know what to do with. So it's not about the food. It's not about weight. It's not about body. I just happen to be binging on food. No one has ever made positive changes that I know of because somebody just yelled at them enough to do it, right? It often entrenches the behavior more or makes people drop out. So it really should be about compassion and grace and understanding and acceptance and being heard because I'm struggling with something. So, what am I feeling? What do I need? And it's not about my body. It happens to be affecting my body, but it's not about my body.
Such important key takeaways and overall such really helpful information that you have shared today, Dr. Dorau. We really are appreciative of your time and your expertise. So if you've been listening to this today and you have resonated with it, please share this video with somebody that you care about. You can also find resources about our discussion today in the description. And also please comment, like, and subscribe. You can listen to this podcast on YouTube, Apple, or Spotify. And you can also message us on YouTube, Facebook, or LinkedIn with suggestions of questions you'd like us to discuss in future episodes.